Hi, I'm Dr. Dimitrios Kostopoulos, co-founder of Hands-On Seminars, and today we're going to talk about a patient's vicious cycle. Frustrated? Don't be. So how many of you have seen this patient response repetitive pattern after you apply your treatment, where the patient will get better, then they go home, they get worse. You treat them, they get better, they go home, they get worse, better, worse, better, worse. And it is this like roller coaster. Patient better, patient worse, patient better, patient worse. And your treatment just cannot go through and break that vicious cycle. And you are so certain that the treatment you are applying is the right treatment, but then something happens when the patient is away from your care for a couple of days and the patient is getting worse. What is causing that? What's the mystery? So in the case, for example, of myofascial trigger points, which are hypersensitive, hyper-irritable points within the belly of a muscle, in that case, you may have referred pain pattern. Pain that is referred to a distal part of the body from the original location of the trigger point. So why, while you treat the patient, that referred pain pattern goes away, when the patient goes home and they return to their activities, the referred pain pattern comes back? So let's talk about the story of perpetuating factors. What are perpetuating factors? Perpetuating factors are factors that the patient is subject to and they are out of your control. These are factors unknown to you as a therapist that the patient is being influenced by, and because they are unknown to you, that's why you cannot intervene. So let's take, for example, a patient with horrible headaches. That patient happens to have myofascial trigger points of the sternocleidomastoid muscle, causing them frontal headaches, occipital headaches, pain in and around the ear, perhaps even tinnitus, noise in the ear, pain around the eye, blurred vision perhaps. So this patient comes to see you, you treat their sternocleidomastoid muscle, they get immediately better. And then they go home and they get worse. Why? Because while they are at home, they are engaging into some type of activity unknown to you, which activity activates the trigger point that you have already deactivated. So you treat the patient, they got better. But then they go home and they start reading a book while lying down in bed. They're watching TV while they are lying down in bed, putting the neck into a compromised position, either or over-shortening, overstretching, or overloading of the sternocleidomastoid muscle. And that is a perpetuating factor. If they use the wrong pillow, if the pillow they use is a pillow that is either too thick or too thin, and they place that pillow, instead of placing it between the shoulders and the head, they place it under the shoulders. Imagine what's going to happen. The neck will be maintained in an overextended position, stretching the sternocleidomastoid muscle throughout the entire night and activating those trigger points that you have deactivated previously with your treatment. So perpetuating factors is definitely something that you have to look for as part of your evaluation, because this can be the answer to this vicious cycle, to this roller coaster problem of getting better and then worse, getting better and then worse. And of course, this, amongst other issues, is covered at the myofascial trigger point and myofascial release therapist course of Hands-On Seminars. This is our PT1 course. And for more information, go to www.handsonseminars.com.